I'm going to show you how to cope when the world has been canceled. Hi, I'm Dr. Mattu, clinical psychologist, and the coronavirus outbreak has completely disrupted the world. Here in Northern California, we are on a mandatory isolation. We're not supposed to leave our home unless it's for absolutely essential things. My wife's work is completely canceled. My daughter's school has been completely closed. And we're not alone. This is what's happening all around the world as a way to reduce the spread of coronavirus and increase the chances of not only survival for the most vulnerable populations, but also reducing the burden on our healthcare system. The world healthcare system just cannot handle a global outbreak at the level of which we're seeing. So what do you do? What do you do when all the ways in which you cope with the stressors, the difficult challenges of the day, the ups and downs? What do you do when all of those things are canceled? When you can't go to restaurants and hang out with your friends, when you can't go to the community events that you go to the religious services, to the things that give you meaning and purpose, all the stuff, all the ways in which you and I have worked to create a schedule, a routine that helps us, all of that is canceled. What do you do? Well, before I get to that, before I answer what you actually do, I want to just talk a little bit about what we know what happens in this kind of situation when you are in a isolation environment, when there has been an outbreak, when you're in a quarantine environment. How does this psychologically affect people? Well, there has been research done both on past outbreaks and quarantines, as well as some research that's happening right now about the coronavirus outbreak. What do we know happens? Well, we know that post-traumatic stress type of symptoms are very common. So what does that mean? Feeling very irritable, like you have a hard time dealing with your emotions, you're very easily emotionally set off. A lot of anger, being very hypervigilant, being very much on guard. This is actually something that is normal and healthy in this kind of situation, to be more anxious, to be more aware, to be more on guard, to be more likely to wash your hands and to look out for potential ways in which you might get this illness. You want to be on the lookout for those kind of things. Hypervigilance is healthy in this kind of crisis situation, but you might also feel more isolated, or you might be struggling with memories related to this, images related to the coronavirus outbreak. You might be very mistrustful of other people. It might feel hard to enjoy things that you usually enjoy. I know for a lot of us, we can't go outside and do things that we enjoy, but if we're at home, we might have a hard time enjoying things that usually we like doing at home. You might have a hard time sleeping, might be experiencing nightmares. You might feel very detached. So all of these things, these are the kind of post-traumatic symptoms that are very common in this type of crisis situation. And then we have confusion, anger, feeling a lot of distress because you're separated from the people you love. You know, I had to tell my parents to cancel their trip to come visit us. We haven't been able to see my wife's parents and our daughter. It sucks for her, and it sucks for her grandparents, our parents, because they are separated from one another and they love each other. And, we're doing that because my daughter's grandparents are vulnerable to this. And so there's a lot of disruption that happens there and a lot of distress. You might experience frustration, boredom, not have enough supplies, not have clear, reliable information. It might be financial loss. So since I've gone independent, I spent the last few months lining up opportunities to bring in income. And in the last 2 weeks, all of those opportunities that I spent weeks or months developing, all of them have been canceled. Small businesses everywhere. A friend of mine runs a small business, and he is thinking about if he should just close it all up and close up shop, because all the income, all the operating expenses, all the payments for employees, all of it, it's all gone overnight. So there's going to be a massive economic disruption. Bathroom flushing? That's my daughter. This is what happens in a outbreak situation, not your normal video. And then the stigma too. If you have developed this illness, there's a stigma related to having it, to talking about it, all that sort of stuff. Okay, so this is what it does. This is how the canceling of the world impacts the mental health of all of us. So what do we do? Let me take a drink of water. That's what I'm going to do right now. Okay, what do we do? Number one is you have to bring your offline support online. So this is the big challenge, is everything we did to support our mental health, we need to find ways to bring those online now. So for example, I want you to think of 5 people. These are the 5 people that you are going to be regularly in contact through this crisis, through this self-imposed social distancing, and for some of you, quarantine as well. You need 5 people: a family member, a friend, a colleague, maybe a healthcare professional, or your therapist. Think of 5 people that you are regularly going to be in contact with, and then figure out a plan that works for you of how to stay in touch with these people, whether they're phone calls, FaceTime, Zoom meetings, whatever it might be. You need these 5 people in your life. Now, why 5? Because sometimes people are busy. Sometimes they have to deal with their own responsibilities, wild stuff happening at home. So you can't just have 1 or 2. You need to have 5, and these are going to be your go-to people. And find a way to stay connected to them. One of my favorite ways to stay connected with folks right now is to watch stuff together. There are all these plugins available that allow you to sync up your Netflix and watch with someone else. Or you can do it another way and just put something on your computer, put someone on Skype, put them on FaceTime, and just go 1, 2, 3, and then play a video together and watch it. There's also other ways you can bring your offline support online. So I talked about therapists. A lot of therapists out there were doing telehealth sessions with their patients so you can stay in touch versus video. That's what a lot of us are doing. But the same goes for personal trainers and gym and all of that sort of stuff. A lot of fitness folks, fitness people are doing online sessions on Instagram Live and on YouTube Live. And there's also, if you're someone who loves being outside and touring outside and going to museums and stuff like that, there are a lot of museums that have online tours available. You can do that. There are a lot of performers out there who are performing live for YouTube. So find the things that you really love doing that helped you with your mental health, the people that helped you, the activities that helped you, and now find a way to do them online. All right, that was number 1. Number 2 is quit the endless scroll. So what do I mean by endless scroll? Twitter, Facebook, Instagram, YouTube, all of these social media platforms have an endless scroll. You're never going to get to the bottom of them. And sometimes we do this for distraction, sometimes we do it for entertainment, sometimes we do it because we don't know what else to do. But we're at home, we're stuck here. If I spend some time just going through the endless scroll, it could be hours and hours. It's not going to be like that because my daughter's here. She'll barge in, and she's not barging in right now because she's a little scared of this camera, but she would barge in and I would get disrupted. But if I'm alone or after she goes to sleep, I could spend hours there. And right now, each of these feeds is primarily full of really scary stuff. And it is not healthy for me to let all that coronavirus media just wash over me. It's not a healthy place. So you have to heavily restrict your social media, unless you're someone who manages it well and it doesn't impact you. But I don't know. Most people, it's hard not to be impacted by all the social media nowadays. So here's what I recommend, because this is what I found to be helpful for me and for people I work with. Get your news 2 times a day. Once in the morning, once in the evening. Turn off all the alerts for breaking news and all of that sort of stuff. If something important is really happening, you will find out. And probably nothing big is going to change during the day. If you get your news once in the morning, once in the evening, you're going to be caught up. You're going to know what you have to do. I recommend getting about 3 sources of news. So number 1, get some type of national news. What I do is I listen to the headlines from NPR in the morning and also in the evening. I like it because it's audio, so I don't have to see all these images that stress me out. So get your national news. Get your local news. I also get that through my local NPR affiliate, so that makes it easy for me. And then get some news from experts. So the disease, illness experts in your country. For me, that's the CDC in the United States. For you, it might be the World Health Organization. Find experts who are the leading scientists tackling this problem and get your news directly from them as well. So a national news source, a local news source, and scientific experts. Why is that? Because if you're getting conflicting information, or if you're getting information from untrustworthy sources, it has a tendency to increase panic. It has a tendency to lead you to make some decisions like going out and buying a ton of toilet paper. When we don't get clear information, we're not really sure what to do, and our anxiety goes up, and then we do dumb things like that. So to keep yourself getting trustworthy information, check 2 times a day from 3 sources: national, local, scientific experts. I'll put some links in the description below, and stick to that and limit your social media. Another thing you can do on social media, things like Twitter or platforms like Twitter, they allow you to mute out terms. So you can mute out coronavirus, you can mute out outbreak, stuff like that, and your feed might be a little bit of a more mentally healthy place for you. Okay, number three way to cope with the canceling of the world is reboot your system. So this week, many of us are in a social isolation, at-home situation. Schools have been canceled in the United States. Everything is canceling all around us. Some of you watching around the world outside of the United States, maybe you're further along than us, or maybe you're a little bit behind, but it's probably similar things probably going to happen to you. Now is the time to reboot your system. What do I mean by that? It's really important right now for us to develop new habits, new rituals, new schedules for our day. You might not realize this, but the schedule you had before, a few weeks ago, getting out of bed, getting ready, breakfast, going out where you have to do, doing the things you have to do, coming home, seeing the people you have to do, all of these things help you to stay, how we say, behaviorally activated. These rituals, these routines, these help you to have a sense of what to expect, what to do, all that sort of stuff. We need to create a whole new normal now. And we have to find new things that keep us active, connected, and engaged. So what does that mean? Find a routine. And if you're not sure what to do this. Track your activities for one day. Write down in one column what your activity is, what you're doing hour by hour. And then write down next to it how it impacts you. Do you feel good? Do you feel bad? Do you feel bored? Do you feel distracted? Do you feel energetic? Do you feel lazy? What is it that you're feeling when you do this activity? And then rate the intensity of that feeling, 0 to 10. Now, at the end of the day, I want you to take stock of what helped you and what didn't help you. what you'd like to do more of and what you'd like to do less of. And then try incorporating that your next day. Just make one change for the next day. This is from a treatment called behavioral activation. I've got a video for it. I'll pop it up right now. That video can help you to do this in more detail. The other thing that you want to do is, if you're working from home, you probably want to create some environment in your home or some ritual that helps you transition to that activity, and then will help you transition out of it. Just because we're now stuck at home doesn't mean you're going to be working 100% of the time. That's not realistic. And it also doesn't mean you necessarily want to work on your couch, because that's where you go to relax. So you might want to think about changing your environment a little bit to help you have that transition from being at home to being at work to being then back at home situation. Okie dokie, I'm looking at my notes. Okay, thing number 3 that you want to do is master a thing. So many of us right now are feeling helpless, and we feel bored, and we feel like there's nothing we can do. In these kind of situations, it is so helpful to build mastery. So what that means is focus on something that really absorbs your thoughts, absorbs your attention, and requires some work from you. This can be a book. It can be some kind of project that you have at home, something you need to fix, or something that you want to improve upon. It could be an online course that you take, but find something that you can do for a prolonged period of time. It's going to absorb your thoughts, and it's something that the more you work on, the better at it you're going to get. If you're looking for a book to read, I love Atomic Habits by James Clear. I also love Why We're Polarized by Ezra Klein. Building a Life Worth Living by Marsha Linehan. She's a renowned psychologist. It's a really great memoir. And also An Astronaut's Guide to Living to Life on Earth. It is by, I should know his name. I'm looking it up because I don't know. Chris Hadfield. Awesome astronaut. It's an astronaut's guide to living on Earth. Awesome astronaut. Love that book. So check out those books if you're looking for a book recommendation. If you want a home project to work on, organize your family photos, organize your personal photos. There's a wonderful video by Johnny Harris, How to Remember Your Life. I'm going to pop it up right now. Check out that video and start applying that to your own family photos. The thing I love about that too is you're going to experience other emotions going through those photos that is going to give you a little bit of perspective and a little bit of a disconnect from this daily life that we're in right now. You can organize them. You can make a photo book. Just follow Johnny Harris's advice. I love that video that he made. How am I going to... online course too. If you're looking for... hey, sweetie. If you're looking for a online course, the thing I recommend right now is University of Pennsylvania's Positive Psychology course on resilience skills. These are the skills that we all need right now, resilience skills. There's a free course from UPenn on resilience skills. So you can take that. That'll help you. It'll be amazing. So check that out. How am I going to apply this? Well, my daughter just got one of these. If she saw me holding hers, she would be really upset right now. So I will put that away. She's got a little yoga. Hi, sweet. Hey. I'm just showing them your ukulele. Is that okay? Yeah. Okay. I'm gonna get my guitar. Oh man, now I just spoiled what I'm going to be doing. But I have always loved guitar. I have a guitar. I learned how to play it like so many years ago, but I'm really bad at it. I only know how to play one song, Blackbird by the Beatles. So the thing I want to do, this is probably really out of tune because my daughter's been playing with it. What, sweetie? You want to listen? Oh no. Do I even know how to play Blackbird anymore? Okay, anyways, this is my mastery. What I want to do is pick this up. I want to be able to play a song with my daughter. I want to be able to enjoy music with her and enjoy creating music with her. So That's my mastery project for coronavirus, end of world stuff. Okay. Oh, another thing is, if you're looking for, if you don't want to do a full online course, but you still want to learn, you want to build some mastery, check out Crash Course on YouTube. Of course, you can check out Crash Course Psychology. They also have a really great series on history of science. But the other one that's super fun, they've got a great crash course on video games. Check that out. It's awesome, really well done. I really liked that course, so check that out. Okay, thing number 4, I think we're on number 4 now, is distancing versus isolation. So right now, the recommendation in the United States is social distancing. What that means... Yes, sweetie? Play guitar? Okay, what if I just hold it while I'm doing the video? Is that okay? You want me to sing Do Re Mi? I don't really play it I don't know how to play it. Can I just sing it? Do, a deer, a female deer, Ray. Okay, how about I just go, Do, a deer, a female deer. Like this? Louder? Do, a deer, a female deer, Ray, a drop of golden. Can you say it? Okay. All right, I'm going to get back to the video, okay? So social distancing is different than isolation. So if you're sick, you do need to isolate yourself. But social distancing doesn't mean that you can't go outside. I will sing. Can I sing Do Re Mi to you after the video, sweetie? Please. Do, a deer, a female deer, Ray, a drop of golden sun, me, a name I call myself, Fa, a long, long way to run. So, a needle pulling thread, La, a note to follow, so, T, a drink with jam and bread. That will bring us back to a deer, a female deer. Okay, can I get back to the video? Please, a little bit. I'll come back to you. Okay, I promise. So social distancing doesn't mean that you can't go outside. You can go outside as long as you stay away from people in the recommended CDC guidelines. I can't remember I think it's 6 feet away from other people, and you want to be in a small group, preferably the group that you've been socially isolating yourself with, like your family, your friends, or your roommates, whoever you're living with. So if you want, get some sunlight from outside. Go for a walk, preferably in an area where there are not a lot of people, like hills or open nature area. That's a good place to go to get a little bit of fresh air, get some sunlight while still being able to socially isolate yourself and stay away from other people. So remember, social distancing doesn't mean isolation. There are still ways in which you can go outside. Okay, I'm losing count now. I think we're on number 5. Number 5 here is find compassion. This is an unprecedented moment in human history where we are globally trying to stop an outbreak in a way that we never have before. The closest thing was the Spanish flu, but we weren't as interconnected as we are now, and we didn't have the ways in which we could coordinate the whole world as we do right now. So have compassion for yourself. This is not a time to finish all those writing projects you've been stuck on, because you have to take care of yourself. Just because you're at home doesn't mean you're supposed to be a productivity machine. Find compassion for yourself. That also means finding breaks. If you're working from home, it doesn't mean you work from home 24 hours a day. You still need to take good quality breaks. And what a good quality break means is you need regular detachment. You need detachment from the activities you're doing. If you're crunching numbers in Excel, you need to do something that gets you away from numbers. Maybe something that's visual, maybe watching a TV show. If you're a therapist who is spending all day doing telehealth appointments, you need time to detach from other people and not focus on other people and be able to do something that takes you completely away, like maybe losing yourself in a book or some music, something like that. Have compassion for yourself. That also means if you need help, if you are struggling, if you don't have enough supplies, ask for help. Ask family, ask friends, ask your neighbors. Be compassionate towards yourself. If you need the help, ask for it. If you need money, ask for it. This also means being compassionate towards your neighbors, checking in with your neighbors to see if they need anything, checking to make sure that people who might be more vulnerable have the support that they need right now. This is the thing about humans, is we rise to the occasion of these crises by lifting each other up and working together as a community. That's what we have to do. We have to find that compassion. If you're a parent, have compassion for yourself. We want to develop some type of new rituals and schedules for our kids, especially those who are out of school right now. But we also want to loosen up our restrictions around TV and phones and video games. As much as you can, do some of those activities together, but realize that you can't put into place the same limitations we had before. This also means gratitude. Gratitude is a super emotion that not only lifts you up, it lifts up the other people that receive it, and it lifts up all those people who witness it. So think about what you are grateful for today. For me, it's everyone working in the grocery stores, everyone working in restaurants to cook the food, to make sure the food is ready to nourish this whole population. These are the people who are risking themselves, along with healthcare employees, people who are working in delivery, people who are working in different aspects of our government, who are keeping everything together. Write a post, make a video, share it on social, or another thing you can do is write a letter of gratitude. Think of someone who you are directly grateful to, and then send them that letter. It can be an email, it can be a text message. Send them that letter. I have made a coronavirus playlist, which has videos on how to deal with depression, coronavirus anxiety, how to keep yourself from touching your face, quick ways to reduce anxiety, psychological first aid, and how to deal with your emotions. I'm popping up that playlist right now. Check out that playlist. I'm also, one of the things I'm going to be doing more is I want to do some live events to create some space for us to hang out and just celebrate things that make us feel better. So I'm going to be doing some of that. And I also want to thank Dr. Kristen Kunkel for giving me this idea to make this video and helping me come up with some of these ideas. And last but not least, we're in this together. We're isolated and we are together, and we're going to get through this together. Okay. I think that's it. I'll see you soon.